They didn't want medications. They didn't want the benzodiazepines. So they were saying no to conventional treatment. I don't think we need more evidence to show that nutrients are good for supporting stress.
So many women struggle, and then so many women go to their GPs and get offered either a contraceptive pill or an antidepressant.
We were hearing the women who were going through our studies telling us that their PMS was getting better.
I've had women come in with significant PMS, probably almost would meet the criteria for PMDD, and go on micronutrients. And then, within 3 months, the third cycle, I literally get a phone call saying, I didn't even know I was getting my period. If people out there are experiencing severe PMS, you might want to try a high dose micronutrient and see how you feel.
When we started the research, which was in 2007, 2008, adult ADHD was not accepted in New Zealand as being a legitimate diagnosis. I think there was still the belief that you grew out of it when you turned 18. We had 47% of them identified as much to very much improved, and it was 21% in the placebo group. So it was a really good outcome. I was taught that nutrition was irrelevant to the brain when I went through clinical psychology trainings. As we age, our ability to use nutrients becomes less efficient and we're not as good at it. So you might need more nutrients as you age. If you really want to do a study that's going to change the world, then we need to do it in people who are pregnant. We are forever grateful to those 88 women who took that chance. I wasn't prepared for what we found. Women who were randomized to the micronutrients more likely to be very much improved if they were randomized to the micronutrients compared to the active placebo. The diversity of the microbiome stayed stable in the micronutrient group and got worse in the placebo. So there's something about what happens in pregnancy where things are depleted and getting worse. If the antidepressants were working, then they would be depressed. All we have to say is, why aren't the risks being lowered?
It was one of the mouth dropping moments. I was like, what the heck? Why aren't we doing this in psychiatry? Why aren't we looking at this? Why aren't we embracing this?
It's at the heart of why I do what I do, is to help people who have mental health challenges. That's why I went into this work.